can you tell us what is your assessment about what is happening at the moment in terms of both domestic abuse and child abuse, particularly in the home at the moment? And then my second question to you will be, what is top of your list in the measures that you want to see happen now? Nicole Jacobs.
Hi, thank you. I chair a weekly call with all of our national helplines and main services for domestic abuse. And on that call, I'm joined with officials from government departments. And I suppose, the obvious thing to say about domestic abuse and the COVID epidemic is what a deadly combination it really is. If you think about domestic abuse and the motivation to have power and control over your family, and overlay the lockdown circumstances on that, you would easily surmise the increased risk for the individual. So I suppose my greatest concern is about making sure that people who are subject to domestic abuse, adults and children, understand that there's help available. There's been a great deal of work within specialist services and the police and other critical services to really adapt what they're doing so that they respond to domestic abuse. And first and foremost, before I think about my top list of things to do, it's partly to make sure that people out there who are subject to domestic abuse understand that there's help available, even in the best of times. Sometimes that's not the case. And so I think supporting our helplines, making sure we have resilient services, charities, refuge spaces is really, really important. And thinking about the breadth of ways that we can increase our ability to access and be able to offer support in a way that we haven't before, where we have much more limited circumstances in ways to get to families. And so thinking about whether that's through retailers, through our NHS volunteers, neighbors, employers, we need to think creatively and quickly about how to allow those types of people who will be more likely interacting with families and our eyes and ears to understand that domestic abuse is a key concern during this time, and that they know what help is available.
And do you have Sure. I'm sorry to interrupt you, but do you have an assessment of what is happening at the moment? We've heard, obviously, reports of calls to helplines going up, but we've also heard from some police forces who've said they haven't had an increase in calls to the police. What's your assessment of what is happening?
So in that Monday call, obviously it's not the only call, but it gives us a sense of the week. As the weeks have progressed, we're now in our fourth week of having this regular summary. You're right, and you've seen it reported in the media fairly accurately, and steady increase in the help seeking through helplines, but also virtual, web chats. Looking at web pages, all of the helplines, and I'm sure you'll hear from the next panel much more specifically about that. Quite huge increases on some days. So it's not steady every day. It's about 25 to 29% increases in general, but on some days much higher, 120% increases in calls, sometimes higher than that. So what we're hearing from the helplines is complexity, so people calling with more complex needs. We're hearing an increase in volume in general, but also real concerns about what options are available. Similarly, what we hear from the police, so the police this week have started talking about having more increase in non-crime domestic calls. So in other words, an increase in call outs, but not necessarily resulting in a report or a crime. So in some ways, it's early days, but I think at least that means people are calling. That wasn't as much the case a couple of weeks ago, so we're seeing a slight change in pattern there. But we don't. But you're right to know that the police are not seeing a huge spike. But all of the police, this is from our national police lead, Louisa Rolfe, Cressida Dick, they're all concerned about that because they would agree and understand that domestic abuse will be on the increase during this time.
And just so I'm clear, in terms of the top of your list of things that need to be done, the top of your list was information for people who might be suffering.
Yeah, I have a few things. I would say, one thing to make clear and not to grandstand about this, this is a sector that was suffering from a postcode lottery pre-pandemic. So this is not a group of services that are equal across the country or funded in a robust way. So yes, we need the public awareness, and we need people who are subject to domestic abuse to really understand that we're out here and we're planning for them and that they can access support. So that is first and foremost. But sitting beside that as an equal importance is just to appreciate that the main services that we depend on are often vulnerable. They will certainly be losing funding during this time. They won't have an ability to fee earn. The people who do runs and all sorts of things to fundraise for them will not be able to do that. And so the charities themselves need support. So over the weekend, you'll have seen a £2 million announcement to support our helplines, which is absolutely needed. There are increased costs that helplines will be incurring from diverting their calls, upping their technology and all sorts of things they're doing to keep running. But the greater concern that I have right now is how will we use the money announced by the Chancellor to best effect for this crisis. Unlike some other issues, we know that domestic abuse and violence against women and girls are particularly important during this time. So we need to see, and in this week, I appreciate it was just announced on Wednesday, but we need to see a clear view of how charities will quickly access these funds. And important to me is not using our traditional channels or existing channels, meaning not to be overly dependent on channeling funds through the local authority or the PCC, because this is how we had our postcode lottery in the first place. So there are many small charities, there are many specific charities that serve disabled women or BME populations or specific groups that won't necessarily be able to access existing channels for support. And so we need to allow those charities to be able to quickly and very simply bid in and get the funds they need to sustain what they're doing, but also to plan for the inevitable surge that we will have. There will be people who are waiting and trying to survive every day, and then will access support as quickly as they can when some of the lockdown is lifted. So those are really key priorities right now.
Thank you. Anne Longfield.
Well, the huge change in children's lives, of course, is that schools have been closed for most children, apart for children of key workers, but also vulnerable children. That's been a huge change over the last few weeks. And with that becomes a real risk that a lot of children who would be picked up and noticed by schools when things are going wrong become invisible. Now, I've been really reassured, pleased, relieved that schools have continued to offer places for vulnerable children, those with social workers. There's many who are vulnerable who don't have those places. But the numbers of children who are coming into school in that category, anecdotally reports are that they are lower than was expected. And at the same time, you've got families who are without the support that they might otherwise have. Children's centres are largely closed. Support around the school, parenting and the like. So the range of services that would have been there in normal times to support families are largely not there in the same way. And also the place where professionals are able to pick up and notice, and half the referrals to social services come from schools, are no longer operating in the same way. Now, in terms of how local authorities and others have responded to that, I think there's been a great response locally in most areas. People are doing are motivated. They're really changing and reconfiguring their services virtually overnight, and many doing great things and reaching out to families in need. But the risks are bigger than that, and I would also say the solution is bigger than, you know, a fantastic set of staff teams, even a fantastic local authority. We know that there are babies and under fives that are particularly at risk, and also teenagers at risk in a different way as they start to struggle with lockdown and what that means and the vulnerability that they would see. In terms of domestic abuse, we know half the referrals to social services involve domestic abuse. We know that 2/3 of the women in hostels will have children with them, and we know that children suffer as victims of domestic abuse alongside adults in their household too. We also know there's around 800,000 children who have experienced domestic abuse in the last year. So these are significant numbers.
Thank you. Simon Fell.
Just following up on that, what do you think we should be doing to mitigate the risk to people who are at home during this pandemic? And on Phil, to start with you.
There is a lot of activity, as you can imagine. I think there is a huge task to persuade the vulnerable children who have a place into school. Also a need for that definition of who is vulnerable to be relatively flexibly looked at locally. So it's not just those with a social worker, because we know that there'll be as many, if not more, who don't have a social worker. We know the police chiefs are very worried about that group. So getting those vulnerable children into school will mean there's the line of sight, there's a structure in their life, there's safety there. But that's, you know, that's not a task without challenge, because families don't like the idea of stigma, and also, of course, are worried about the infection itself. So that is a task in itself. Identifying who those vulnerable children are and where they are is a huge effort even before COVID-19, but it's very, very important during COVID-19. And the DFO working on a dashboard, a national and local dashboard. We've been developing one and helping them with that too. And then really a systematic and far-reaching response to mean that once you've identified those kids, actually you are reaching out to those families, making contact, keeping in contact, visiting when needs be, but certainly distance contact. The whole of the kind of child protection system, which relies so heavily on judgment and visits, has had to be remade in about a month. And that means most of it is now done through the screen, which in itself, as you can imagine, brings its own challenges. So really, I think seeing that robust ambition to visit, to be able to keep in touch and really know those families and be alongside them during this crisis.
Thank you. Nicole Jacobs?
You know, I've talked about the funding. I've talked about how we allow for people who are our eyes and ears and who are in a position to help to really be communicated to directly, neighbors, employers. What are the things you can do to help in this situation during this time in particular, and allowing them to be supported to do that. There are a lot of obstacles and challenges for people in domestic abuse to access help. So if you're a migrant woman, for example, and have no recourse to public funds, we need to alleviate some of these obstacles to support and routes to support. So legal aid is another. We need to allow for legal aid right now to be accessible to all to all victims of domestic abuse, priority need for housing. There's a lot of things that we could do that are kind of in the way of getting support for people who are in a crisis. A great example would be our get out orders, called the domestic violence protection orders, that the police would like to use, but sometimes will have challenges to use them because they don't have an appropriate address for the perpetrator to go. They may have difficulty getting into court because of court closures. I know some of those things are being prioritized. All of that can get unlocked a lot more quickly if we had a cross-governmental working group. So Vera Baird, who I know is hopefully joining us soon, and Anne Longford and I, we all sit on various groups throughout the week in various government departments. But until now, we have not had a cross-governmental working group. Probably the best thing we have is the Monday call, where I have people from our specialist sector and all government departments. But in order to unlock all of those things I've listed off as progress, we can do it, but we would do it a lot more quickly if we had a cross-governmental working group and plan that could report into government on progress in quick time.
Just thinking, there's quite rightly a focus on victims, but I wonder about the perpetrators too. What should we be doing to help them and therefore protect the people in their households?
Simon, just to interrupt for a second before bringing witnesses back in, can I also welcome Dame Vera Baird, who has joined us, who's the Victims Commissioner as well. And Vera, once the other witnesses have answered Simon's question, I'll just come back to you for just some opening thoughts as well. But sorry, back to you, Simon.
Thank you. Nicole, why don't you pick up?
You mentioned that there are a lot of efforts in terms of focusing on the behavior of perpetrators that need to continue. So one of the critical ones is our national helpline. So we have an organization called Respect, who are funded and run a national helpline for people who are worried about their own behavior. And that helpline has promoted really targeted materials and guidance during COVID, which we should all be promoting and making sure people know about, because it is one hope for people who are getting frustrated at home, who are reachable, who may need support and guidance specifically for that. But with perpetrators of domestic abuse, I suppose it is a range. It will always be a range. And so we also need to strengthen the ability for the police to enforce orders, to hold perpetrators to account, things like those get out orders, the DVPOs. Some police areas are really actively planning and trying to locate housing so that when they need those orders, they have that ready and that isn't an obstacle. So there's a whole range of things that we need to do. Another thing I would highlight for you that I've heard police colleagues talk about is the need to extend the time by which people could report crimes. So there will be people who are experiencing abuse right now who aren't able to call the police, it wouldn't be safe for them, but they may well want to report a crime later. And so we need to allow for some extension to what the normal timescales would be for that kind of thing.
Thank you. Anne Longfield?
Nicole's just said, I think, in addition, very clear messaging that domestic abuse or indeed child abuse is a crime, and that it's something which will be absolutely treated with utmost seriousness. The police, to have them continue to make this a priority in both their messaging but also their actions is really important. And I think also, going back to that other point, having people in touch with the house, having people in touch with the family is that clear way to get those early warning signs. And that has to be as real as possible during this time of lockdown.
Thank you. Can I just welcome Vera Baird to the evidence session? Really pleased to see you, and that the technology is now sorted. Vera, can I ask you your assessment of what is happening at the moment in terms of the level of abuse taking place, or in terms of what is happening with services? And secondly, the top of your list in terms of what you think needs to be done now to support victims.
Yes, I think to save lives in this pandemic, we are ordering some people to stay locked up for a long time with people who will damage them, and they know that. And that has been staring the government in the face. Let me say straight away, the announcement of funding for charities, though we don't know how much will come to help victims of domestic abuse and sexual abuse, is welcome. The promotion by the Home Secretary at the weekend is very welcome. But I think it has been quite late in the day. I would guess that during my absence struggling with my iPad, you've heard from my colleagues about the evidence abroad, almost every country where this pandemic has happened. And indeed, there was a great article in The Guardian about it on the 28th of March, saying where lockdown has caused an increase in domestic abuse and an increase in sexual abuse, particularly of children and of online. And of course, we have police campaigns every Christmas to counter domestic abuse, which we know will increase by just those few days, compelling people to be together for a long time. And so it was imperative really from the start that since this was part and parcel of telling people to lock down, that there should have been a strategy of prevent, protect, pursue, and so on, which is what one usually does when there's an anticipated level of crime to increase. Currently, I have a call, clearly Nicole and I work quite closely together, but I have a call every Monday at 11 a.m. with the victims service suppliers who are funded by the PCC. So I have a selection of those, and they phone other people and tell me what's happening in their region as well as in their own area. And there is definitely, as you've seen from the refuge statistics, an increase generally in domestic abuse calls. There is a far bigger increase in online contact. And I know that Refuge's webpage had something like a 700% increase in visits recently, which suggests that people are looking at somewhere where there might be help. And this could possibly be the victim themselves, or it could equally possibly be a neighbour. We now know that about 40% of notifications to the police about domestic abuse come through neighbours. But there's a bit of variety. In the southwest, the call to Avon and Somerset showed a decline in reports of domestic abuse. In the northeast, there was a spike over the last weekend. In West Yorkshire, in one part, Kirklees, complaints of it are up to the police, and in others not. In London, there's been a spike of about 7%, i.e. not a great one. In Wales, and I'm lucky enough to have all the Welsh ones filtering through one PCC to tell me what's happening in that principality, domestic abuse complaints are down. Nobody, though, ever has doubted that domestic abuse and child abuse have escalated. And so the worry is where it isn't being reported. Is that because it is just difficult, impossible to do it on a telephone, for instance, when your perpetrator is sitting beside you in the next room or never far away? So I know that the organisations have tried to move online as quickly as they can, and the take-up on live chat and those things has become bigger. But we urgently need to adapt to that inability to report. In particular, I think one place, so I mean, over the years, we've learned clever tactics. We have Operation Encompass now, which when you can go to school, because if you're a coercively controlled person, you're usually still allowed to take your children to school. And that means that a school is a place where you might be able to speak to somebody about it. Now, the equivalent, of course, is the supermarket. So you may be a very controlled person, but the likelihood is you're sent out to buy the food. And also, of course, pharmacies where you can go. And we urgently need to copy the French model, which has been introduced in the last couple of weeks and properly funded by President Macron, which is to have emergency provision available in supermarkets and pharmacies. Probably, Chair, you've come across something called Ask Angela in the past, which is an emergency sort of code word. When people are in a bar and they're worried about the person they're with, they can go to a bar and say, is Angela in? And the bar person is trained to understand that code word, and it means take me away and get me a taxi home. You could have a very similar system, easily training local workers in supermarkets to just respond. So if people are able to come in, and we fill the places with posters of Priti Patel's new campaign as well, if people are able to come in and talk about what's happening, fine. But maybe that's not so straightforward, and you wouldn't know what to say to a cashier. So an option to have a code word so that you say, ask Vera, and the person says, that means this to me. And they need to have a quick card which says, do you want me to call the police? Yes, I'll do it. Come in here. Do you want me instead, if the answer is no, to call Women's Aid? Yes, come in here. We need to be flexible because people are locked in, and this is one channel of escape. The other thing that is very problematic, I think, is accommodation. And you asked me for my top two. I mean, I can talk a bit, as I'm sure Nicole and Anne have, about how the sector is coping, but certainly almost all the refuges are full. And when they're not, there are problems about somebody who's infected, so it can't be opened up more widely. It is not easy to find accommodation. I mean, there is, the homeless have been given a good arrangement, 3.2 million, to get homeless people into hotel accommodation, people who are being released from prison, care leavers. There is always a dearth of move on accommodation, but here it is critical. And if we can't move people on, we can't rescue people into refuges. So fine, the Home Secretary said it's lawful to leave if you need to leave. And of course it is an exception to not going away from your home, but you do need to have somewhere to go. And an emergency package from the government to fund accommodation would be most welcome. Could I say that yesterday on my call, Swansea University had contacted the South Wales Police and Crime Commissioner to offer a scheme of their spare accommodation, now students are not there, for victims of domestic abuse if they can come out, and some arrangement be made to facilitate that. That seems to me an excellent idea. Clearly that PCC will take it up. If that can be done in Swansea, and by the next call on Monday, I'm expecting there to be some progress, it can be done elsewhere. There are resources that can be made available. The sector itself has written to hotel chains, backed by Nicole and myself, Marriott in particular, to ask if they will give rooms, and they have come back with some questions and some difficulties, but this requires government intervention to organise it and to give assurances to the hotel chains, as does the help in supermarkets require the government to intervene with the British Retail Consortium. The sector can do a little bit, individual PCCs can do a little bit, but it needs the power of the government for these two very, very important aspects of how we try to rescue people. I've said little about children, and I'm sure that Anne, who I know well, has said a lot about children, but it is perfectly obvious that since a very large proportion of abuse of children happens at home, that when parties are at home and can't get out, it will increase. And that is, I think, everyone's expectation, that kids can't go to school. Social services without PPE, I understand, are not being allowed access to difficult homes, where, of course, they will say, no, you're not coming in because of social isolating. And we need equally a strategy there. The perpetrator helpline, which your colleagues just asked about, has seen an increase in men who are perpetrating, in particular, coming to say, now my behavior is concentrated and I can see what it is. And that must be a very good thing. But they were asked to pull together a package for some funding a couple of weeks ago. And as far as I'm aware, that hasn't happened, because they too have got thinned out by staff catching the virus or being in isolation. And they need more support, and they need it urgently. And we need to support perpetrator programs in the community urgently. So by analogy with funding the helplines, you have to fund all the services that go around it, and you do with the perpetrator end as well. We do suggest that there has been not a strategic approach, and that what is needed is a better strategic approach, which embraces all the relevant ministerial responsibilities, so the key departments in a subgroup of the Cabinet Office Committee, but requires the addition of these three commissioners who can help to bridge with the sector and ensure that any schemes that the government can bring in, of the kinds I've just exemplified, fit the sector, so the sector can deal with them and take the matter forward. I think that strategic matter is very, very urgent.
Thank you. Stuart McDonald.
Thank you, Chair. Two questions from me, if I may. The first more specific, the second a broader one. And I'll start with Nicole Jacobs, if I may, and then ask Anne Longfield and then Dame Vera. Ms Jacobs, you already mentioned a little bit about women with, or migrant women, and in particular women with insecure immigration status. And we've heard evidence or received evidence about 4 in 5 women with insecure immigration status being turned away from refugees and also facing barriers in seeking medical assistance. I think you've mentioned no recourse to public funds. So are you calling for that to be suspended? You've mentioned legal aid and you've mentioned priority housing need. There are also issues around NHS charging and data sharing as well that you might want to comment on. So that's the first sort of specific issue, is about migrant women in particular and what we can do to help protect them. And then the second broader question is simply, are there other groups who may be particularly vulnerable that we need to be thinking about a specific response for too? So we can start with Nicole.
Thank you. I would call for the no recourse rules to be alleviated altogether, COVID or no COVID. I mean, there's no reason why someone who's experiencing domestic abuse should not be able to access safe support. So that would be something I would have been campaigning prior to this. And I think it's so much of this crisis is showing us some of the vulnerabilities and the cracks in our system where people fall through the net, and have been for many, many years. And we're just seeing it more acutely now. And it's something I absolutely agree with you. We should do something about. I know that NHS charging for COVID-related issues, it's been made clear that regardless of any kind of immigration status, that NHS charging is relieved. But I think some of unlocking a lot of those challenges is about ensuring that we support the kinds of charities and services that really reach out and form trusted relationships with migrant women or migrant people, so that they understand what these changes are. That you can call the police, that you can access health. And that requires much more of a word of mouth. That requires translation services. And so that's what I was talking earlier about the funding needing to be flexible and making sure that we get from the Chancellor's very welcome announcement, the funding to charities who are expert in this area, who can really address that well, and who are in a position where they have the networks that's really important. The other thing I would say just about migrant women or women with no recourse is their worries, long-standing worries about information being passed to the police. So if they were to call the police, the fact that we don't have a firewall means that they would worry, will details about my status be passed along to immigration services? We should make clear that people can call the police and access support regardless. And again, getting the message out on that is really important, and using the partnerships of charities is particularly important. In terms of additional vulnerabilities, some of the things that have come out, again, I would say these are long-standing issues, but they've come across in the calls week to week during this time of the lockdown, is related to disabled women, the additional barriers. Again, those are charities that are not often getting the kind of funding that they need, and they would cover a wider geographical spread. So giving money to the local authority or a PCC may not get to the charities, or the very few charities that we do have that serve disabled women, so deaf women, women with physical disabilities. And the kinds of complexity about that comes out in the call, for example, would be, what would you do if you were a disabled woman now who needed to leave your house? What kind of care package would you anticipate you could get very quickly? And I think we all know the answer to that would be very low. It would be unlikely. And so we need to be able to talk directly to experts within these charities to relieve the barriers that are currently happening there. I guess I would also just want to point out some of the things I've heard about from our LGBT helpline. Gallup has talked about the increase in complexity of their calls, the fact that you overlay homophobia. People may be self-isolating with family members who are not necessarily supportive of them, and the increases there. And one quite big increase in a lot of the helpline calls across the board are adolescent to parent violence. So this is, again, a long-standing issue where we know from DHRs, for example, a fourth of our domestic homicide reviews are adult children who've killed a parent. I'm not saying that's the same as the adolescent child-parent violence, but I guess my point is we don't have a lot of services that are really specialists in that area. And so we do need, during this time, to be able to really seek advice and to support the very few charities that do that, so that we can address in much more quickly what's needed for some of those additional vulnerabilities. Those are the ones that I can think of right now. I'm sure others will chime in with different issues.
Sure, thank you very much. Longfield.
To start again by reaffirming, as Nicole's just reaffirmed, the fact that actually these services and these children, services were under stress and stretch previously, but also the majority of these children were almost invisible in the past, pre-COVID. So in work that my office has done over the last few years, we identified that of familial child sexual abuse, only 1 in 8 of those experiences were actually, those children were known to the authorities, which means that most of that is hidden. When you look at the 800,000 children who have experienced domestic abuse in the last year, actually only 150 of those will have a social worker. So there is something here about children being invisible in normal times. Obviously, I would argue strongly that's something we need to fix for the future, absolutely, but is under extreme pressure now as this emergency becomes very apparent. The families with no recourse to public funds, clearly, as Nicole said, there are additional pressures there, and desperate reports where I can see solutions being found that at least start to offer some sign of hope there. It's often around schools that are almost now acting as community hubs. They individually know those families, they're reaching out to those families, they're supporting them with food and with other essentials in their lives. So yes, I would, as Nicole would, support an ending to the regulations and restrictions around those families. I think it's important to remember as well the number of families that will be now relying on universal credit that weren't previously. And we know that from the police chiefs, one of the things they're reporting back is when there's an increase in reporting around domestic abuse, financial hardship is one of those issues. So with near on 1 million people signing on to universal credit now that weren't before, clearly there are pressures there. And added to the kind of so-called kind of toxic trio of issues around vulnerable families' lives, domestic abuse, severe mental health conditions, and also addictions. Poverty needs to be added into that as a real factor here. So there are a whole range of issues more broadly outside the home. There are groups of teenagers that I would say are at risk in terms of criminal exploitation and sexual exploitation. And that's clearly needs a different approach there, but nonetheless a very vulnerable group.
Thank you very much. And finally, Dame Vera, if I could come to you.
Few weeks a report called Sowing the Seeds, which makes links between domestic abuse in the home and a child, the impact on a child that can have, and their subsequent sexual exploitation or criminal exploitation. So these issues are very damaging, and we are setting ourselves up a long heritage from the events of this pandemic. What is very important is, as Anne's just been saying, that children are perceived as victims of domestic abuse, as well as when they are themselves sexually abused. They are now regarded very much as witnesses who, if they were not in the room or were not literally there, are not being damaged by it. And that radically needs to change very quickly, and it needs to be recognised now. Could I say I'm very worried indeed about smaller charities dealing with the kind of people that my colleagues have just referred to. So in particular BME charities and men's charities, which of course are smaller because fewer men are subject to domestic abuse, but they do need nonetheless to be mentioned. LGBT, those for disabled people. And I'm particularly worried about them because of the way that the package of funding is going to be allocated following the Chancellor's announcements. So it's in two tiers. One is going to be distributed through the departments of state. That's the government's 370 million. There are problems about that going through individual departments and a lack of cross-government links. But the local charities, at the moment, the Ministry of Justice, which is dealing with this, has sent a note to PCCs asking them to identify charities who need help from this fund, who they already commission. Now, many charities of the kinds that I've spoken of, smaller charities, specialist charities, absolutely critical, as Nicole has described, to their vulnerable client groups who won't come out anywhere else but with these specialist charities. These are often one town only places, and they are often not funded by the PCC, but funded by a whole range of small packages of funding. And so if one just uses that route, we will miss an enormous number of charities that need to be given help urgently now, because clearly those small specialist charities are more vulnerable themselves and less well sustained than the larger charities are. It is long overdue that we cracked the issue of no recourse to public funds and the intervention that comes between a police officer and his duty to support a complainant of domestic abuse and concerns about immigration status. And that simply must stop in this crisis and hopefully never come back, because it is totally wrong that people are helpless in the face of abuse and cannot escape in our country at this time. There is one more thing just to add, which is a particularly vulnerable group, and forgive me because I came late, I don't know if anyone's mentioned it, is sex workers, who are very disadvantaged generally as we No, they obviously have the difficulty that if they are street sex workers, they are likely to fall foul of police very readily, and indeed their work is going to be extremely hard. But they are likely to suffer greater cruelty, greater exploitation, greater abuse in this extraordinarily tense time, and they are at higher risk. And we urgently need the police and charities which support them to be properly funded and properly alerted and properly supported to make sure that they too, a small group but an important one, can be made safe.
Thank you very much.
Tim Lawton.
Thank you, Chair. Commissioner, can I come to you? I should also first declare an interest as I chair a safeguarding board for the OFG Children's Group. On child protection, Commissioner, you said quite rightly that the whole child protection system has effectively had to be redesigned in the space of a month or so, and that obviously social work for child protection is not a science, and it very much relies on the training, the gut instinct, the experience of a social worker, usually going into a domestic environment to get a sense of what is really going on. That, of course, is not happening at the moment. So what actually is happening? Have social workers, to the best of your knowledge, been given new training and alternative ways of trying to detect and deal with child protection issues, given that they can't use conventional measures?
So Anne Lonsfield.
Yeah, I was going to say there are 3 commissioners. Yeah, I thought you meant me by the subject.
Always known you as the Commissioner Anne. Yes.
So you're absolutely right. So much of this is about relationships. So much of this is about the feel of visiting. So much of this is about signs from the household and the like. Now, I think that most social workers are absolutely trying their best in terms of getting and replacing that through a screen. Certainly, all local authorities that I've spoken to have now begun at very least, and some are succeeding very well in grading their seriousness and vulnerability of children. They will have different responses to different levels of risk. So, for instance, those that they are very worried about, there will normally be home visits and there'll be more regular contact. Of course, what social workers will say is that, it's both difficult to pick up those signs, but also quite easy to hide the signs through a screen. Social workers will ask to be shown around the house via the screen, even look in the fridge. And many are doing that. So, they aren't holding back here, but still it is very difficult to get that sense. And also they don't have that ability to be able to kind of, move the conversation on and to something else and look around. That doesn't mean that I think that, it's a hopeless case. That is something which I think needs to be continued, but nonetheless I would say we need this face-to-face contact, which is why I'm so concerned that more children come into school where there is that line of sight, but also that actually workers are able to go visit. Now, some of that is around PPE, some of it is about having enough people, and I'd like to see a whole backup of people who are DBS checked but possibly furloughed from elsewhere. But also, I think, as Nicole and Vera have said, really this strategic coming together, this strategic collaboration between local charities, social services, and schools. As well as I do, there's always been gaps there where, everyone kind of does aspects of that and specialisms. Now is the time, I think, for that local collaboration. And yes, the funding for those charities, but also that packaging of support is really important. Home Start, for instance, has got some very good ideas. They will get access to homes that others won't if they're able to, but they need funding behind them to do that.
I'm sensing that nobody has really issued protocols, be it social worker organisations, Association of Directors of Children's Services and others, for dealing with those families that are obstructing that sort of access. Now, if we were in normal times and a social worker made a visit and was not allowed in the premises, then there are ways of scaling that up to get access to the premises. if a social worker is not able to access through a screen, and there may be not a screen available, there may be all sorts of excuses about, oh, my screen doesn't work, then where do you go? Because the next step is not then knocking on the door with an enforcement officer at whatever level. And linked with that, and we've heard a lot about schools, and you mentioned the clear link with schools as the sort of early warning sign, because that's where children spend more of their time if they're at school age than any other professional. Are you aware that schools are checking up on those vulnerable children who are not coming to school now because they're not key worker children, and are there procedures in place to make sure that they are looking out for them as well?
Okay, so there is guidance on contact with families in crisis, those that are outside school. The guidance from the DfE is a first stage. Important that it was to get that out. It needs to continue to develop. There are some gaps in it. There are concerns that actually this allows too much freedom rather than being very specific about protocols. Locally, there will be protocols, and again, local councils have responded swiftly, I think, on that, but they are in emergency mode at the moment. People have had to move fast to get new procedures, new ways of working into place. The difference will come, of course, now when this is the new normal for the next month or the next 2 months, the next 3 months, whatever that is. So it needs to go deeper, and it needs to really ensure that any element of particular confusion or non-clarification is absolutely very clear. And there's a role for that locally, there's a role for that from professional groups, but also from government too within that. Schools are in many cases following up, but as you would imagine, there are schools that do this week in, week out as their bread and butter. They support communities, they have close contact with communities, and they have that vital community role. There are other schools who are more distant from their communities, maybe where there are only a few vulnerable children, all those vulnerable children are largely hidden. That won't be what they're normally used to. What they have to do is they have to report to their local council when there is a child who's vulnerable that hasn't turned up that they were expected. Yeah. But as time goes on and, the numbers of children are low, then that becomes much more tenuous, really, within that. So it's something which I think in the emergency phase has got to a place where there's the makings of a system there. Now it becomes a new normal, then there has to be tightening up of what the protocols and guidance has. There has to be a greater emphasis on those children having to come back into school rather than if they so wish, unless, of course, there is a dialogue and a discussion with a social worker that actually opts them out. The expectation, government is clear that they do come in, but actually putting added pressure and actually making that a requirement is something which I think needs to come next.
Finally, can I ask Nicole Jacobs briefly, just on the subject of refuges, and obviously we've got vulnerable women with vulnerable children as well accessing those refuges where they can. What are you seeing in terms of social workers being able to get access, again, through a screen for child protection issues, and also what health measures are being taken within refuges? I mean, goodness knows it's difficult enough to get those victims and get them into a secure place in a refuge, and then you've got all the considerations of, around isolation and social distancing, and whether they're bringing in infections or joining somebody who's got an infection. How on earth do we get all the protective measures, including PPE, into refuges that we're desperately trying to get in the rest of the community as well?
I'm glad you've given me the opportunity to talk about that, because that was high on my list and I was wishing I'd said it earlier, is the need for refuges and domestic abuse workers is similar to social workers to have access to PPE. Yep. The examples I've heard, they've had to pay enormous amounts for their PPE, the PPE they do have. Sometimes they're getting generous donations in order to pay for PPE. It's really variable across all services. And so I think, there are key workers within a refuge. So in some ways, the protective measures and the support are there. So social workers are often very relieved, and they would see, I think they would be more worried for people who haven't made it to the refuge or who haven't made it to services, so that, usually there's quite a good linkage between a refuge service and a social worker, because there's a key worker there who knows the family, understands about food. I mean, food is another concern, deliveries to refuges, they're confidential locations. There's all sorts of practicalities that our frontline workers are working out daily in that respect. So I think, there's guidance in some of you're about to have a panel with Refuge and Women's Aid and IMCON, who will all be advising their services or their members about the safety and the guidance for COVID in terms of self-isolation. And you do have some refuges who are having to not be able to take. They may have a room, but they may have COVID within the refuge, and so they're not able to take in someone. So that's where we're seeing what Dame Vera mentioned earlier, in terms of a lack of spaces and a concern about needing to have a plan in place for spaces. I just wanted to echo a couple of things that the Children's Commissioner mentioned, which is about.
I'm going to,
sorry.
Sorry to interrupt you, Nicole, but I think I'm just going to apologise that because this evidence is so important, I do want to extend this evidence session, so I want to apologise to our next panel for keeping them waiting for a bit longer. But we do have, we have to complete this evidence session by 12:15, because there are other select committees who also need to use the same technology. So I'm going to just ask, anything where you simply want to reinforce points that other panelists have made, do please do that in writing afterwards. And if everybody could keep their responses now as sharp and focused as possible on the things that we absolutely need to now do in order to provide support for people. I'm just going to bring in the other questioners, and I will give each of the commissioners a chance at the very end to tell us anything you didn't get the chance to mention that you really think that we need to do. I am conscious that this is an immensely important subject, and we do want to cover as much of it as possible. Janet Davey.
Thank you, Chair, and thank you, panellists, as well. Obviously, the many adults and children who find themselves vulnerable at this time aren't able to access the usual networks and support systems that are there in place for them. And obviously, this is already being touched on, but how else, or what else do you think needs to happen to enable charities and social services to be able to reach out to these people that probably hasn't been mentioned already, or where you would like to just emphasise those points? And if we could begin with just Anne Longfield, really.
The whole infrastructure about going to school and meeting other parents and networks and local organisations has largely been stripped away. I think, going back to my point before about having strategic alliances locally with charities, working with schools, working with local councils in a joined up, planned way is really important. I think having local information that is very clear about places to go for help and information is really important. And really, again, to endorse what Vera said about having those national schemes that will involve supermarkets and pubs and elsewhere about where you can go in an emergency, but actually having information and places you can go locally. So anticipating the need, anticipating that there's a loss here, and then moving into a place where it becomes norm to have places you can go for help.
Okay, and Dame Vera, would you like to add anything to that?
Said about the need for local networks and for all places to which people can have resort now, to be very well aware. Probably I need to add one thing, which is the police, of course, are out and about, and we all think that they are simply enforcing lockdown and ensuring that there is social distancing. I am very well aware, though, that they are also looking for anything that might be giving them evidence of this kind of private crime, and I commend that. And I would encourage people who see officers not just to expect to be told to go home, but if they do have a cause of concern, to speak out. It is the fact now that about 40% of calls about domestic abuse go to the police, not from the victim, but from a worried bystander of a family or a neighbour or a workplace type. And so we need to replicate that with particular watchfulness. And I've got to commend the Home Secretary's campaign to raise awareness about the need to watch for your neighbours. And clearly the police are out in the community now, probably more than they have been for quite a while, because hard crime, public crime, is reduced. So it's key that people watch out for each other, that people don't hesitate in the same way that we're encouraged for terrorist issues to say, mention it if it doesn't look right. That's exactly what people should be trying to do wherever they can do that now. And the police are ready to respond. The head of the National Police Chiefs Council made it clear on Saturday in the press conference that they have got capacity because other crime is reduced, and so no one should hesitate. And there are, of course, the direct way to get some very speedy action. But I hope we can also get the government really to commit to introducing a system of rescue at the places, the sole places that people who are in difficulties can go to now, which are largely pharmacies and supermarkets. I mean, there's no going to your GP. There's an excellent system called IRIS. GPs have now been trained, quite a lot of them, in order to respond to sensibly and properly to complaints about abuse. But you can't go to your GP now and do it. And it's very difficult to make a phone call if the perpetrator is in the next room or standing beside you. You probably haven't got a phone call at all.
Thank you.
Another possibility, really quickly, is when ordering food, which you can do online, the British Retail Consortium, one member of it has proposed that there should be a red button that could be fitted to all of the ordering access points, so that if you're in danger, you appear to be just ordering cabbages, but actually you can press a button and get some help. That would obviously simply bring the police, but it is another idea. We have ourselves now a massive responsibility to ensure we think of everything we can creatively to reach out to a needy public who are in this position to help protect us.
Just one more question. Actually, Dame Vera, you've anticipated my question and you've answered it. And the second question was very much, what do you feel about the response of the government, the Home Office and the police, and what more do you think can be done, which you've obviously touched on that. Is there anything, would you like to say anything more before I go on to Nicole Jacobs?
I think we have mentioned, I'm sure my colleagues have mentioned, what we are worried about in terms of the funding packages and how they will work. I've already set out clearly, I hope, the dangers of the lottery aspect of it, that the PCCs won't penetrate far enough unless they're expressly asked to, and at the moment they're not being asked to do that. The other thing is no one has the first idea how much funding can come to charities for domestic abuse or sexual abuse, and the government really needs to earmark some funding specifically for these so that we can understand what is available and the urgent need for cross-departmental working. So, for instance, I've emphasised the need, as I'm sure my colleagues have, for emergency accommodation moving on from refugees, but that has to have with it support, floating support from domestic abuse charities, help for children. People will have left home without any funding at all. And so whilst the bids for accommodation will go through MHCLG, any bids for accommodation related support like floating support will have to go either through the Home Office for domestic abuse or through the Ministry of Justice for victims. And that kind of non-matched together funding bids are poor. It needs to be done cross-departmentally. I would like to say that the criminal justice system and the family justice system need to do more. It is perfectly clear that since this isolation has to be done, but it's being done at our, as it were, request, legal aid should be granted to everyone without means testing of any kind in order to get protection, whether it be an injunction, a domestic violence protection order, an order for children. And the issue of no recourse to public funds for migrants just has to be completely scrapped. But the courts have to make clear that these people are a priority, and there will be hotlines for any help that's needed directly to legal assistance. Whilst Mr. Loughton was talking about social services, I realised that I wanted to mention that contact between parents is causing stress and tension, as one can imagine. Of course, orders should be fulfilled. If there is a court order, children should be transferred, and that's a legitimate reason to go out. But if you've got a doubt about whether the partner at the other end is socially isolating, or a doubt about whether the child will come back because that partner's worrying about you socially isolating, there is real tension. And I understand from my victim services call that that's leading to more domestic abuse. We need an urgent, easy way to resolve disputes about contact, which are obviously brought to a fine point of stress by all of the COVID problems. That those things need urgently to be done by the system.
Thank you. And Nicole Jacobs?
I guess so many points have been raised. The only thing that hasn't been said that I would add that I think would be a very good practical intervention at this stage would be support for the LGA to the local government association to really give guidance. I mean, there is guidance from government, but I would envision something that could be more helpful and practical about in any local area. What are the range of services, the MARAC panels, the kinds of services that need to be happening and need to be ongoing, and the proactivity that we were talking about early on behalf of children's social care and others. There's some great guidance about there. The role for housing providers, for example, to be checking in on their tenants where there's known domestic abuse. The Domestic Abuse Housing Alliance has some great guidance online. There's really good guidance out there for how to function for the MARAC, the Multi-Agency Risk Assessment Conference panels to still be happening. But I think, as Anne talked about, there's good practice, and there's also a need to kind of, for any local area to be reassured, whether you're a councillor or you're an officer within the council. Are we doing all that we can for the coordinated response to this? So are we doing all we can for our specialist services to maintain, but they can't work in an environment that is chaotic. So we need to be more proactive in terms of what good looks like, what are areas doing that is really working in respect to domestic abuse. And we need to do this in very quick time so that people can be reassured what they are doing well and what they're missing in the middle of their planning in so many other ways. So that's just the only other intervention I would have. And just while I can, I would like to say Dame Vera spoke about sex workers. There's a great briefing done by the End Violence Against Women Coalition that really speaks to the wider range of violence against women and girls and the issues related to COVID. And I know we can't cover all of that, but I would just encourage members to have a look at that briefing paper.
Thank you. Thank you, Chair.
I'm going to move on to Deanna Davidson.
Thank you very much, Chair. Really, it's a question about kind of communications and messaging, because, for example, we know that under the guidance, people are able to leave the home if they need to seek that sort of support. So a question that's sort of twofold. Firstly, have we been communicating that message clearly enough? But secondly, we really, it seems, need a strategy for people who are having their communications devices controlled by their potential abusers. So on that vein, what strategy would you put in place? I'll come to Nicole first.
Thank you. I would say, the campaign launched at the weekend, at home doesn't mean at risk, and, the hand with the heart. I think, that communicates to people who can see it, obviously, which is your point. We're here for you. There's support available. We need to get behind that campaign so that people can see that there's help available, whether it's visually on, people have put rainbows on their windows, they could put the handprint, and we need to just see that campaign come alive. We've been asking for that type of campaign for years and years, so I'm really pleased about it. But I don't think it's really as simple as any one thing, as so many of us have talked about differing examples. And that's not because there's not a coordinated approach. It's just that with domestic abuse and with this unique problem, we have to recognize that for some people, it will be the housing officer checking on them, or somebody, the neighbor or friend checking on them, and maybe a use of a code word. For some people, it will be the online shop, or, we have to just think of these opportunities, the NHS volunteers who might be delivering prescriptions or parcels. So we do need this kind of a breadth of kind of a thread running through anything that we're doing to make sure we're making the most of each and every opportunity. And that's not easy. I appreciate that's not easy, which is why I think so many of us have talked about this idea of a coordinated approach across government. So, for example, the Department of Health and Social Care on one of the calls that I chair talked about commissioning Mind for more mental health related support. Well, there would be a thread of domestic abuse that needs to be incorporated into that support. And in that helpline, are people picking that up? So I guess what I mean is we have to just look across and be smart about what's already happening, where we can not necessarily take over wholly, but have a thread of work related to domestic abuse, so that we're making the most of all of these opportunities. And certainly the idea of a code word or a helpline, which Dame Vera has really described really well. So I won't say that. That would need to be couched within a coordinated response. And I do think my understanding about the national campaign is that each week, there will be certain stages of it. It was launched on the weekend, and I fully expect that government has listened to some of our input in terms of what needs to happen to really make that comprehensive and joined up.
Thank you. And Dame Vera, is there anything that you'd like to add on this?
Such a good question, if I may say so. And it's very key that the messages go out both at national level, which they started to do, and Nicole's picked up on that, and from the police. I think in first weeks, people thought that the services had probably closed down in parallel with the shops, and the police were too busy sending people home. And that needs to be made very clear at national level and locally. But I really second what Nicole said about the ways that you can contact people who are being kept away from contact. If they're allowed to walk the dog, say good morning to everybody you pass who's walking a dog, in case it's a critical moment when they can speak. But I saw something the other day that gave me an idea. I was in a park and there was a vehicle going round making an announcement: you should only be here for exercise. If you're here for any other reason, please go home. Those are happening quite a lot. You could add messages onto that to say, and if you have a problem, however it's expressed, call this number, do this, speak to this person. There's a man in the hut here who will help you. Seems to me we've really got to be creative, nationally and locally.
Thank you. And quickly to Anne as well.
The whole issue about messages and national messages, I think clearly there's been very positive ones over the last week, and messages onto all sorts of fronts during the emergency. I think, this is a time when national messaging has never seen before. So it's something which we know, as Dame Vera just said, could have a real impact here. And those messages, I would say, need to move on and deepen. I would like to see them involving child abuse as well as domestic violence. But I think then also this local implementation, which means that professionals, wherever they are, however they are accessing communities, are reaffirming that national message. And again, that message that actually communities at this point need to be looking out for each other.
Thank you. Laura Farris. Laura Farris. So for the technology to click for you.
Sorry, my apologies, Chair. I just wanted to ask a couple of questions about the adequacy of the police response. And you may or may not know this, but I wanted to ask if you were, I think all of you have described a slightly kind of uneven pattern of reporting of domestic abuse. And that seems to have prompted a concern that it's being underreported, not that it's not happening. And I wondered whether you were aware of the ratios of arrests and charging decisions that have accompanied any of that data. And if, for example, you'd seen a higher correlation than usual of, say, a perpetrator being remanded in custody immediately, or perhaps less arrests. I know, for example, that the Ministry of Justice has released some prisoners who were nearing the end of their sentences earlier. And I just wonder whether you had sort of any data that informed your view of the police response, that, for example, very serious incidents were getting reported, or that the police weren't reacting as much as normal. If you don't have that data, please don't worry. You don't have to force an answer. I just was interested in the question. Dame Vera, perhaps first to you.
Police Use Council have made clear that they expect the spike to charities to come first and the reporting spike to come later. And so, as you say, there are places where reports have even gone down. But it's clear, and I don't have anything about arrests, but it's clear that the CPS have announced that domestic abuse cases are a priority. Though, of course, the courts are in difficulties dealing with all cases. They put them pretty near top of the list, and they put more guidance out yesterday about how they proposed to deal with them, which will feed into how the police deal. I think what is really urgent is for domestic violence protection orders to come into their own now. The police use them sometimes. Now it is obvious, and the Home Secretary said it herself, that the best solution if domestic abuse is happening is to put the perpetrator out and leave the family where it is. And that's exactly what a domestic violence protection order can do. And it has to be applied for by the police, and it is very, very quick. So I'm hoping that that is being very much promoted as the tool of choice within the police to get a speedy solution. And I certainly know that it is in Northumbria, where I used to be the police and crime commissioner, because I have got some particular views there, but no data, I'm afraid.
Before I actually move on to Anna Nicole, I might just put my very last question, because I think that ends the session. And it was just going to be this, and you can choose whether you want to answer the first bit or this. Is there anything that has arisen from the lockdown that has led you to think of something that should go into the domestic abuse bill, which is due to have its second reading, I think, quite soon? So not something that was already in your mind before the COVID-19 crisis, but is there anything specific that has arisen and that you now think needs to go into that bill?
Thank you.
I'll go to Nicole first, perhaps.
Great, thank you. I would just say a quick point about policing just before I get into the bill. But one is about, this idea this week, the police are talking about having an increase in non-crime domestics. Normally, that would raise my eyebrow a bit, because what you would want to see is more arresting and charging, or those reports translating into that. I think now, I'm not sure that I would view it in the same way. If neighbors are calling, as Dame Vera has mentioned, and people are reaching out to the police, I suppose the one thing we haven't said about the police yet that I think is really important, and I know Louisa Rolfe and colleagues are working on this, is just for the police to understand the opportunity they have at that moment, whether there's a arrest or not. They have an opportunity to communicate really key things and about support services, about just key messages to people within the family at that point, no matter if they're arresting or if people are asking them or encouraging them to arrest or not. So I think just that role of the frontline officer, we just have to appreciate, and I'm really happy to see that the calls are happening no matter who's making them, and that they're able to have that intervention, that point of intervention. In terms of the DA bill, I'm really pleased that you mentioned it. I suppose just going back to what I said quite early in this session, is absolutely the things that I would have been arguing for about the DA bill that need to be included are absolutely front and center and evident in this crisis, which is the postcode lottery we have for services, and the fact that there needs to be an expansion of the statutory duty proposed in the bill beyond housing related services. So if you think about the kinds of things that we're talking about and our reliance on these services, why wouldn't we in the domestic abuse bill make sure that the funding into the future will always be much more secure, and we could achieve that in the bill. I think that there are things related to no recourse, migrant women, those are the kinds of things that we were kind of saying prior to the bill, but have just become so much more clear in this process in terms of what we need and how urgently we would need it. So I suppose I do have quite a long laundry list about the bill, and hope to come back to you another time and talk about that. But I'll just allow for a bit of time for others. Thanks.
Thank you. Anne Longfield.
In terms of the police response, I think we've been pleased that this has been seen as a priority. There's strong reports back from both the Police and Crime Commissioners group, but also from the police chiefs that this is something which is high on their priority list, but also understanding list, which is something that I think is very, very helpful. It reaffirms the whole importance of the multi-agency responses locally, and also the multi-agency risk conferences. Those are absolutely seen to be vital. I think there are some ambitions here around from the MOJ and criminal justice in terms of getting these through to prosecution, and also clearly the early release scheme intends to exclude anyone that's got a history of domestic violence there, but that's something which clearly will need to be continue to be monitored. In terms of the domestic violence bill, domestic abuse bill, for me, absolutely centre stage, of course, it's around recognising that children are victims within this too, but again, really reaffirming not just the funding, but how the funding is used and how that funding can really put in place the kind of cohesive community response that actually those children and those families and those victims need at that stage and in the future. And with that, a really important focus on housing.
Thank you very much. Thank you. We need to bring this panel to a close. Thank you very much, all of you, for your evidence. Wave at me now if there's something really urgent that you didn't say, but otherwise I would ask you to pass on any other information to us in written evidence. Dame Vera Baird, very, very briefly.
One very quick point to make is that counting dead women has got to a total of 16 domestic abuse killings in the last 3 weeks. We usually say there are 2 a week. That looks to me like 5 a week. That's the size of this crisis.
Thank you very much. That's very sobering and powerful evidence to us. Can I thank the first panel? We will have now a few technical changes while we move to our second panel. I think that final evidence that we had from Dame Vera Baird shows just how important this issue is, and we're grateful for our second panel for joining us as well. And I think the reason that we in the Home Affairs Select Committee have wanted to hold this panel is hold this evidence session is because we too are struck that whilst we are all rightly supporting the government approach to save lives and for people to stay at home, what we also know is that for some people home is just not safe. I can welcome now our second panel to join us. We have Anna Edmondson from the NSPCC, we have Lucy Hadley from Women's Aid, we have Baljit Banga from IMCAN, and we have Ellie Butt from Refuge. Can I welcome each of you to this evidence session, and can I ask each of you, just as an opening question, first of all, what are you seeing at the moment? What evidence are you seeing about what's happening, as briefly as possible? And secondly, what is the top of your list in terms of the things that you would like the government to do? And I start with Ellie Butt.
Thank you. So at Refuge, we run the National Domestic Abuse Helpline, which is a free phone 24/7 service. And we're seeing in that helpline already quite an increase in calls and contacts each day. So the data for the week just gone was 49% higher than our average pre-COVID-19 crisis. That's for calls and contacts. When you look at the helpline website specifically, which contains a wide variety of information for survivors and crucially a web form for women to contact the helpline online, that's seen an average increase of 417%. So we've seen really, really big increases to that service. We know that for many women, the helpline is their first port of call. Of course, we can't discount the government's campaign that it launched on Saturday and all the really welcome media attention that's been on this issue in the past few weeks for increasing awareness of that helpline. So that will certainly be a factor as well. But some very worrying signs about increased level of need, which of course isn't surprising because of all the points the previous panel made about the risk to survivors of domestic abuse in these lockdown conditions. Also, Sally, we know that whilst more people are reaching out and getting in touch with the helpline, there will be a lot of people that can't because their window of opportunity to do so might have been small before and is now non-existent, and it's just not safe enough for them to make that approach. So while we have seen it increase, we are anticipating that there will be much greater increases in the future, perhaps when restrictions start to be lifted. In terms of non-helpline services, we've seen much smaller increases. All of our refuge services are still open. Some have had to keep some places empty at various points as women or children in those services have COVID-19 symptoms. But they are all open. I think really, really key there is making sure that move-on accommodation is available, but also getting those messages out that refuges are still open. And we have not many spaces, but there are a few, and we're still accepting referrals. So it's really, really important to make that clear. In terms of my top ask for government, I think funding is enormously important. Charities, including Refuge, and I'm sure my colleagues on the panel have been really affected by this crisis in terms of loss of fundraising, increased costs to move our services to operate remotely. Issues around housing benefit for refuges is really, really key. Refuges are very poorly, unsustainably funded services anyway, and very reliant on housing benefit. When we have to leave spaces empty because women and children are ill, and we need to make sure we don't, that we keep everyone in our services safe, that's a real sort of financial risk. So the funding from government that's announced couldn't be more welcome, and our absolute priority is that funding, that there's a sufficient portion ring fence for violence against women and girls services, and that it is the funding is administered in a most straightforward, quick way to get it directly to charities that need it. Secondly, we also really echo calls for a coordinated government response to not only understand what survivors need and make sure the machinery of government and the charity sector works together to get that there, but also seek for every opportunity to prevent abuse during this crisis. I think we all know what the risks are. We've seen the emerging evidence from other countries that domestic abuse and other forms of violence against women and girls is likely to increase. So we really need to do everything we can to prevent that, and not sort of afterwards reflect on what more we could have done. We need to be doing that now. I think there's some pockets of really good work, but now we really need to coordinate that to make sure that the risks to women and girls and what they need is being taken into account at the very highest level in decision making.
Thank you. Baljit Banga.
Thank you. So I represent IMCON, which is a second-tier organisation supporting BME women's organisations across England, Scotland and Wales. And so one of the things that I want to talk about is not just the gender inequality in terms of the impact of COVID-19 on our services, but also racial inequalities, which have been occurring during this time and which have been exacerbated rather than alleviated. So in addition to the two pandemics, COVID-19 and violence against women and girls, we are also dealing with racial inequality and justice. And BME organizations have highlighted this in their feedback to us. So since the start of the crisis, we have been engaging in dialogue with our member organizations, and we have also been conducting a survey. So we're gathering data since the beginning of the crisis. And what I'm going to do is report back on the data that we've gathered. So we have seen an increase in referrals to BME organizations. Our members have said that there's been an increase in referrals as they have moved to the online services. The referral sources have come from generic organizations, from statutory services, including health, and from the police. But some of the emerging pattern is worth highlighting. There's been a decrease in self-referrals, generally because some aspects of the provision, mostly the face-to-face provision, has been reshaped. The reason why this is important is that for BME women, they are more likely to access specialist support services via self-referral or from community-based routes. The figure is usually 60% to 70% in self-referrals. So later I will address the referrals from statutory services and referrals from police to for BME women, which is actually increasing. So this is unusual because these agencies are the least likely to refer to specialist BME organizations. The data also shows that perpetrators are using COVID-19 to deliberately target and inflict violence on women. And a pattern is emerging of a heightened state of escalation of abuse. And this means that violence is escalating in severity, with high levels of physical violence being reported. Other forms of violence, such as coercive control, are also evident in the data. For the data that we have analyzed so far, we are finding two things happening simultaneously when it comes to refuge provision. First, there is a suppression of need, which means that BME women are unable to leave the violent home to the safety of a refuge because they are trapped. Nonetheless, the need is there and they do need the support. Second, some women have been able to call refuge organizations to find out about refuge spaces. So in the north of England, we've seen a 30% to 50% increase in calls that are made to the refuges, only to find that there are no spaces available. So far, we have no voids in BME refuges, and this is likely to continue during the crisis period. Women in refuges cannot be resettled or moved on to independent housing during this time due to the lack of housing availability, and also because they are facing significant financial pressures and living in income poverty due to the slowdown of the benefit system and other challenges that the benefit system is producing. So what this means is that BME Women's Refuges will continue to operate to support women housed in them, but there will be significant challenges in the way that they will be able to meet this need. We have also had 2 refuges in London that have had to go into quarantine for 14 days because a resident had shown symptoms of coronavirus. And this could very much continue in other refuges as the crisis deepens. So it's something else that we need to plan around. We've also, from our data, have seen a rise in homelessness as homeless women are being evicted from temporary accommodation, bed and breakfast, and also generic hostels. BME organizations are more likely to support women that experience the most barriers. And by tracking referral routes to services, mainstream generic domestic violence organizations and statutory agencies are now more likely to pass on referrals to BME providers rather than supporting the women themselves. So this has been reported by a number of our members across the countries. This is because of the specialist knowledge and expertise that exists in these organizations to address all forms of violence against women and girls under an intersectional approach. The COVID-19 crisis has enabled organizations, on the one hand, to understand the specialism that BME organizations can offer. However, it does put additional pressures on BME organizations who are operating with very little resources and actually haven't had any additional resources invested in these organizations since the start of the crisis. So an important ask, because we are seeing so many referrals come to BME organizations, an important ask that we would make is that it is important to remember that while underfunded, underrepresented, and under-resourced, it is these same organizations that are on the front line of supporting women before this crisis happened, during the crisis, and hopefully to be around after this crisis. So we are asking government to provide emergency funding to refuges, in particular to the by and for Black and minoritized women's refuges, and that this funding be designated and ring-fenced. We are also asking for additional funding to smaller organizations. These are local groups who work very closely in communities, who work with the most vulnerable groups of people, and to support these organizations through the financial crisis, which is created by the pandemic. We have mentioned previously in various statements that have been put out that emergency resources are needed to support organizations to deal with things like digital exclusion and inequalities within the BME sector, emergency financial resources to meet current need, such as food and other amenities for women who are in refuges, support to organizations to cover costs for clinical supervision that have arisen as a result of the crises, costs to support infrastructure and back office expenditure, as these costs continue to exist for organizations, even though we are working under lockdown measures.
Can I ask you to send the further details of what the funding is needed for in written evidence? That would be immensely helpful.
Yeah, that's fine.
Lucy Hadley.
Thank you. So I'm speaking from Women's Aid Federation of England, and we are a national network of 180 member services in England, and we've got sister federations in Scotland, Wales and Northern Ireland. As the other witnesses have identified, we and our members are really concerned about the increased harm to women and children during this time, and that this was predictable, and that we need a clear government strategy on preventing and protecting survivors during this time. In terms of what we're hearing from women accessing our member services and our direct services, which include a live chat instant messenger service that's seen 41% increase in demand since mid-March. We're seeing four main trends, I suppose. The first, as others have identified, is abuse escalating, cases becoming more complex and serious. Second is perpetrators using COVID-19 as part of their abuse or failing to take the necessary precautions to stop the spread of the virus. And that's been identified by WHO as a tactic that abusers are likely to use. The third, which Dame Vera mentioned, is safe child contact, and that was one of survivors' primary concerns before the pandemic. And again, we're seeing perpetrators use child contact arrangements or breaching contact arrangements for COVID-19 purposes. And the final one is either being unable to escape as planned or being unsure or restricted around the options for leaving. So it's really good, as others have said, we've seen the government awareness campaign at the weekend and the clear messages that you can leave, but I think we feel this took too long, and we've got major questions around how women and children can access safety during this time. I think it's really important to recognise that demand massively outstripped supply for refuges and other community-based services before the pandemic. So 64% of referrals to refuges were declined in 2018 to 2019, and we're 30% below the recommended number of bed spaces in England. That has, as Baljeet has identified, has really severe impacts on the most marginalised and disadvantaged women in our society. In terms of what we've heard from services about the impacts of their continuing to operate, we're really seeing that added to the funding crisis they were already facing, we're seeing a real storm of challenges in terms of staff shortages and reduced capacity to support women and children, the practical difficulties in moving to remote working, real concerns around how to ensure that refuges can continue to deliver the spaces they have got, with the complexities around self-isolation and lack of access to PPE that have already been identified. So only 30% of the refugees responding to our survey had sufficient access to PPE, and fears about loss of income, as Ellie has pointed out already. 85% of service providers responding to our survey had said they'd had to reduce or cancel one or more of their services, and over a third of refuge providers had had to do so. We're seeing a lot fewer vacancies on our daily vacancy monitoring on refuge services, as you would expect, and as others have identified the reasons for that in terms of staff shortages, not being able to accept new referrals, the difficulties of self-isolation in shared accommodation, and simply there being no move on accommodation for the women and children resident there, or just that the refuge service itself is full, as Baljit highlighted. I think...
What was your top ask, Lucy?
Yeah, so I'd say, as everyone else has pointed out, coordinated government leadership is absolutely crucial. It crosses so many different departments, the range of issues we're identifying. The emergency funding, and this being simple, fair and easy to access, we're calling for at least 48.1 million for local domestic abuse services, just to cover costs over the next 6 months. So that's backfilling staff and childcare, remote working and hardship costs for women and children they're supporting. As you heard from the previous panel, we're really worried about how the different pots of government funding are going to be delivered fairly to services if they're funneled through local authorities and PCCs, particularly for the smallest services that aren't commissioned. And I'd echo Baljit's point around ring fence funding for services led by and for BME women and migrant women. I think we need a strategy on accommodation and tackling those practical challenges in refuge spaces, PPE.
We'll need to come on to those in a second. Sorry to interrupt you. Anna Edmondson.
Thanks very much, Chair. Well, as you acknowledged in your introduction, we know that sadly not all children are safe in their own homes, and now that hundreds of thousands of children are currently living in homes where there are real risks of abuse and neglect, which could harm both their physical and their mental health, we know that this impact is being intensified under lockdown, and as the Children's Commissioner highlighted, the school closures have meant that an increasing number of children are going to be less visible during this time, and that is something that is deeply concerning for us. During this crisis so far, what the NSPCC has been focused on is making sure that we're still here for children. In the last few weeks, we've really transformed the way that our key national services operate. So Childline, which is obviously for children, and our helpline, which is for adults who are concerned about abuse or neglect of children, are there. We've moved to remote working rapidly and prioritise that frontline work so that there are opportunities for people to reach out where they can. At a local level, our colleagues at service centres are also adapting to working remotely with children and providing wherever possible and where it's safe to do so, services to children and families to make sure that that lifeline often of support is not removed during this particularly difficult time. And we're also supporting local authority partners with some of our frontline staff if they're not able to continue some of that work and are able to shift in that way. What is really clear from the type of calls that we're getting to both Childline and Helpline is that children are feeling the impact of this crisis particularly. So Childline has been delivering a rising number of counselling sessions to young people who are concerned about coronavirus. Some of the themes emerging from that, and we are releasing these figures later this week, so I'll just give you a bit of a preview of some of the headlines. But you'll be unsurprised to hear that abuse is a key concern for children. So children who are experiencing abuse or neglect at home are now unable to leave the house. They're unable to get support from the places that they usually go to feel safe, such as schools, but also clubs, friends' house, or relatives' houses. There's also worries being expressed about other support not being there, for example, CAM support. This is obviously something that is deeply worrying for us. And I would echo some of the other witnesses' calls to make sure that it's really clear that these services are still, wherever possible, available and funded so that children can reach out if they need to. With the helpline, we have seen an increase in calls relating to parental domestic abuse and concerns raised by other adults about that. And in the first 2 full weeks since lockdown started, the number of contacts that we have received on parental mental health, alcohol or substance abuse has increased by nearly 10%. And obviously that is concerning. One of the other priorities that we have been focused on is that it must be really clear that while it's important that there are avenues for individuals and individual children to reach out for support, safeguarding is really everybody's business, and that it's now even more important, as some of the other witnesses have flagged, that everybody is able to spot the signs of abuse, know where they can go to get support, and make sure that the community is really taking any opportunity to make sure that we can shine a bit of a light on what's happening for children so they aren't stuck behind closed doors.
And your top ask, Anna?
So our top ask, a bit similar to what other colleagues have mentioned, in that we've seen that there's lots of good intentions, there's lots of hard work happening across Whitehall, lots of issuing of guidance, but there is unfortunately a bit of a vacuum of coordination, in that different departments with different remits around child protection are leading on slightly different issues, and that is leading to the missed opportunity to make sure that those strands of work are being brought together. And as well as making sure that's happening at national level, what we also want to see is that the real sort of front line of child protection, local safeguarding hubs who are doing the work of coordinating police, social services, NHS and schools, and who are evolving, rapidly developing good practice, that practice is feeding up to a national level, and it's not just a top-down approach.
Thank you. Stephen Doughty.
Thanks, Chair. You all paint a fairly bleak, unsurprisingly bleak picture, particularly in terms of demand and the pressures on your organisations and indeed the wider sectors that you work in. Can you just tell me, very, very simple answer, have you actually received any of the government funding, for example, that was announced in the charities and voluntary sector package? And what's your understanding of other organisations you work with and whether they've received any of that additional funding yet? Maybe start with Ellie.
Hi, no, not yet. My understanding is that none of that money has reached charities yet, but that the details of how that fund will be administered is still being worked out at central government level. So I believe different government departments are currently bidding for shares of that fund, which they will then work on the guidance. So no, Refuge hasn't, and as far as I'm aware, no other organisations have as well, but I'll leave that to my colleagues to confirm.
Okay, Lucy?
Same as Ellie, no, it's not reached frontline services yet, and we're not clear how exactly it's going to. I think, as we've talked about earlier, as well as the amount of funding, so we're asking for at least kind of 48.1 million for local services, and additional money for the expansion of our live chat service. It's also about the way it's distributed fairly and equitably. For the smaller services that aren't commissioned, don't have good relationships with local authorities or PCCs.
Okay. Anna?
Similar to other colleagues, we're waiting to see some of the details, and we have having other conversations with other government departments about support for some of our essential services like Childline and Helpline, but obviously the speed is of the essence here. So
but you haven't accessed any of the funding yet?
None of the funding that was announced on Wednesday last week, no.
Okay. And Baljit, what about yourself and some of the organisations you work with? And I was particularly struck by what Vera Baird said in the previous session about the particular issues regarding BME organisations and some of the more specialist organisations in not getting access to this funding. I just wondered if you could comment on that.
Yes, so we are concerned that if the funding, so firstly, we haven't received any funding whatsoever. So the answer to the first part of the question is no, absolutely none. So in response to the second part, we are very concerned about how these funds will be administered, because the majority of the BME organisations are not commissioned by local authorities. So if funding is managed through existing frameworks, then it's not going to get to BME organisations, and so there's a really real concern about equitable allocation of funds.
And Vera Baird specifically said that she understood that, for example, the Ministry of Justice had simply emailed police and crime commissioners asking for them to identify organisations. I'm assuming in some areas of the country that might result in organisations where there's good relationships, but in others they would miss out. Would that be correct?
That's absolutely correct, yes.
Okay. And can I ask all of you just about the wider issue of messaging? I mean, in terms of both the messages that are being put out by the government and in terms of that getting communicated to vulnerable women and girls and young people at risk of abuse more generally. I mean, I know in South Wales Police, the Commissioner and indeed the police have added to their sort of advice, their stay-at-home advice, to stay at home, except where that's effectively not safe to do so, and you can leave your home for your own safety or health. Is that similar message being communicated across the UK, or is there a risk that people are interpreting the guidance as that they have to stay at home and face abuse? Maybe start with you, Lucy.
Thank you. So I think it's great that we've started to see that messaging be delivered in a clear and consistent way. I think there's obviously the massive question around then what next. So you can reach out for help and you can leave, but what if there's no space, and what's our strategy behind the communication message? That's a massive question I think we've talked about a lot. I think in addition, it's about ensuring that we're reaching all survivors and all communities, as you say, that we're making those communications as inclusive as we can. The Home Secretary's announcement wasn't, there wasn't BSL, British Sign Language translation alongside it. That's really important. So is translation into different languages, and ensuring that we understand that not everyone recognises the term domestic abuse or is going to identify with that. We need to ensure that we're reaching different communities that are affected by different forms of violence against women and girls in different ways, and ensuring that we're speaking to all groups. We've been doing a lot of work within the violence against women and girls sector to pull together safety and support messaging for both survivors and communities. We're really hopeful that the Home Office is going to expand on their campaign with what we've developed based on our expertise in the sector, and also pay for that to be translated into different languages and into British Sign Language as well, and make it accessible and easy to access for the most marginalised women. I think it's also really important, as you've heard, that we're using the community lifelines that are already available, so the mutual aid groups, the NHS volunteers, that we're ensuring that they're getting consistent safeguarding messaging about domestic abuse and other forms of violence against women and girls, because we know they're reaching potentially vulnerable families. It's really important that they're getting the right communications as well.
Thank you. And Anna, can you just explain the situation? Do you think children and young people are getting the right messages and knowing how to keep themselves in this situation? And I'm also thinking particularly about some of the groups, for example, it was mentioned in the earlier panel, young LGBT people, perhaps, living in a family where their sexuality or gender identity is not respected or potentially put at risk. Just wondered what your understanding of the situation is so far.
Well, to answer that question directly first, well, in terms of Childline, that's obviously a priority for us to make sure that those children who are particularly at risk are able to access support and know that they can reach out. In terms of the government response on domestic abuse, I would just echo what Vera Baird said, which is that whilst the campaign is welcome, it's noticeable that there is unfortunately a blind spot in this part of the Home Office in recognising that children themselves are victims. 1 in 5 children will experience domestic abuse. They don't just witness it, they are deeply affected by it. And it's noticeable that the campaign this weekend, there is not, as far as we can see, any child-friendly or child-facing element to that at the moment, and that is something that we would particularly like to see. More positively, in relation to online abuse, which we haven't really had a chance to touch on, but we know is likely to spike and is a key concern for colleagues in the police, that the Home Office is doing some very positive work, reaching out to tech platforms, to child protection charities like ourselves as well, to think about very creative and innovative ways to make sure there's safety messaging across a range of platforms, so that children and young people in particular know that they can reach out for support. And that's the kind of thing that we want to see more of.
Thank you. Thank you, Chair.
Thank you. Holly Lynch.
Very much, Chair, and just coming back on that point with the NSPCC in particular, if I can, Anna, we haven't really covered the risks of increased online abuse. I'm very mindful that organisations will be looking to engage with children who are at risk from abuse in the home using online means and perhaps over the phone, but are we doing enough to make sure that children are protected from those seeking to exploit them using online methods and grooming in particular?
Anna?
I think Anna's still on mute.
Thank you very much, and thank you for the question. Yes, it is a really key concern for us, as you'd expect, because at the moment there is a threefold risk as we see it, because we know that platforms have reduced moderation capabilities at the moment, because companies such as Facebook and Google have reduced human moderation. They've suspended the use of third-party moderators, and clearly they'll have significant numbers of staff who may be self-isolating. And this is combined with a time when there is increased demand with lots of children at home. And we know from non-coronavirus times that online abuse tends to peak when children are at home for longer periods. So that's obviously incredibly concerning. And we know from the latest data from Europol and also from the National Crime Agency that many abusers are thinking that this might be a current crisis presents an opportunity. So it is incredibly important that this risk is acknowledged. We know that the National Crime Agency and the Home Office, as I say, are looking at this. But there's also an onus on the tech platforms themselves to adapt. I mean, government and social services, as we talked about, have had to adapt overnight to coronavirus, and particularly at a time when we are relying on technology, it's even more important that some of the work that has gone into, for example, the Online Harms Bill, to move towards a duty of care and regulatory model is not paused, because what we are seeing from certain platforms, including somewhat ironically Zoom, which we're obviously using today, but also the growth of new apps and so on, is that safety has to be designed in from the outset, and that tech platforms do have a responsibility to make sure that if we are going to be relying on tech more in the future, that they are safe for all their users, most particularly children.
Thank you for that, and I appreciate that we are getting short of time, but perhaps, Anna, if I could just ask you again, we heard from the Children's Commissioner that where the government has facilitated children who are vulnerable still attending school, but where take-up of that has not been as expected, do you think it would be appropriate now to start looking at mandating that those children in vulnerable families are attending school over this period?
I think the important thing is to make sure that the conversations are happening between schools and social workers and families, because there may be within the broad category of vulnerable children who are eligible to go to school, and as Anne Longfield quite rightly described, it is a very broad category, and there will be children in there who they are safe at home and it's appropriate for them to be there. So, for example, children who are in stable foster placements, or children who are in homes where there might be other underlying health concerns or risks to other family members, which means that school is an appropriate place. But the key thing is you can't really take a blanket approach to this. We need to know what the numbers are and the take-up are so that we understand what might be an issue. Really the key is understanding the reasons why children aren't in school, and the way you do that is, as I said at the outset, through really strong, robust local safeguarding and child protection arrangements, which are able to go into deep conversations and share information and understand, is there a risk here? Do we follow this up, or is this a child who it is safe for them to be at home?
Thank you, Chair.
Ruth Edwards.
Thank you, Chair. My first questions are for Anna. I'm interested in exploring the aspect of online abuse. I met virtually, of course, with the Internet Watch Foundation a couple of weeks ago, and they told me they had seen a large increase both in terms of the reporting of online sexual abuse, of content, because obviously more people are online, but also they've seen a big increase in the amount of self-generated content that children are being manipulated into making. And I was wondering both if you as the NSPCC had seen this increase as well, and how you best thought we could get the message across both to children and to empower parents to have those conversations in order to keep children safe.
Absolutely. So we haven't seen the spike as yet, but we are very concerned about this happening, and we are in regular contact with colleagues both at the NCA and the NPCC to keep abreast of this situation, and we're sharing information in terms of what we are finding from our helplines and so on. In fact, next week we're publishing some research that looks at this kind of children who might be vulnerable to grooming and who use social media frequently, and what that means for the propensity to be able to share images or to share content with adults. I'm sorry, I think my screen has frozen, but are you still able to hear me?
We can still hear you.
Fantastic. Okay, I'm sorry I've frozen in a rather unfortunate pose, but
don't worry.
Yes. So it is something that we're concerned about. We've been working in partnership with O2, and we have resources on our website under the NetAware partnership, which offers advice to parents about the kind of conversations and how to make sure that they're talking to children about what they're doing online, and enabling that kind of conversation, how to do things like set up parental controls, as well as advice on individual apps. And so we would absolutely encourage people to look at that. In terms of what the Home Office could be doing around this, they have, as I said, made an impressive early start and really led the conversations between platforms, international partners, and also child protection charities. But we'd like to see them push some of the tech platforms a bit further to make sure that information that those platforms are currently reporting into the National Centre for Missing and Exploited Children in the US are disclosed and shared regularly and on a timely basis with law enforcement and authorities here in the UK, so that we have a real-time assessment of the impact of this crisis, can identify any moderation issues which need attention and address them. And so it is really something that there are steps that parents can take, but really the onus needs to be on tech firms, but also the government, to help them to understand that they do have a duty here, and that there are things they can do as part of a response to coronavirus that makes sure that children are as safe as possible online.
Thank you. And just in terms of government and the government messaging, there's been quite a lot of government messaging, directed at parents to, make sure you know what your children are doing. It's not safe for them to be out, with other children at the moment. Do you think the messaging about staying safe online in the home has been strong enough?
We certainly know that the Home Office is aware of this and that they are actively planning campaigns around this, which I understand are likely to come to fruition in the very, very near future. And we've been pleased to see those, and we would like to see more of that.
Great, thank you. And just a final question from me to the other witnesses. I think one of the few good things that's come out of the current crisis is the very strong community networks, volunteer networks that have been built up. And I just wonder, do you see any opportunity for using those kind of networks and that community, those community networks in the future for helping to identify and help victims of domestic abuse more broadly? And perhaps if we start with Lucy Hadley.
And I'm going to ask everybody for very, very short answers.
Very short.
Okay. Lucy.
Yeah, thank you. Yes, we've long known and research has shown that communities can either be gate openers or gate closers for survivors of domestic abuse, and that women are often likely to tell the friends, family, someone they trust about the abuse they're experiencing. So it's a really, really important means of ensuring survivors can access support. At Women's Aid, we've been leading a community response called Ask Me for over 4 years now, and we have, I think, nearly 1,000 community ambassadors trained across the UK. They've received 12 hours of in-depth training on domestic abuse and violence against women and girls. They can provide a safe response, raise awareness within their communities and tackle some of the barriers that victims face to coming forward. We want to see far more focus on interventions like that, and ensuring that we can build on the expertise we've got within the sector to train up communities in various different ways to be able to provide that good, safe response. It is about the schemes that you spoke about earlier with the code words, but it's also further than that, and ensuring that we've got people that really understand domestic abuse, providing safety.
Baljit Banga.
So just quickly, that deep community outreach was something that was always done by BME organisations. It is actually a very good trademark of BME women's organisations to be able to work deep in communities, reach out to women who have very little access or have no access to services, and ensure safe pathways to support. So it is a good way, but one of the things that I want to highlight there is that that kind of funding, which was community-based outreach funding, that disappeared a very long time ago. So a lot of that work has been affected by the lack of resources. And if community and volunteer networks are the way to go, or being considered now, the resourcing implications of that would also have to be considered.
Thank you. Ellie Butt.
Thanks. Yeah, I would echo what my colleagues have said about the really important role of communities, and particularly neighbours. I think it's really important as part of these awareness campaigns that we talk about the importance of calling for help if you are worried about one of your neighbours or friends or colleagues or relations. That's really important. On the Refuge website, we have information about what to do if you're worried about somebody. I think the only sort of small concern I would echo is to be minded to how dangerous leaving a perpetrator of domestic abuse can be. We know that that's the time of highest risk for women. So it's absolutely important that specialist organisations are contacted to support women who are thinking of leaving, about how to do that safely and to make sure they've got that support. But absolutely neighbours and all these networks in terms of letting people know what help's out there and calling if they're worried someone's being harmed.
Thank you very much. Can I thank all of our witnesses? We have literally just run out of time on the technology that we have. So hugely grateful to all of our witnesses for the evidence today, both sobering and powerful evidence that you have given us. Please do send us any further information that we weren't able to cover today. And I would appeal to anybody else who's been following the session who has further evidence for us on domestic abuse or child abuse during the coronavirus crisis, please do send it to the Select Committee as well, because we are very keen to be able to respond with some recommendations as a result of this evidence. And then finally, I would also say to anybody who needs any kind of support or help, please don't hesitate to contact the National Domestic Abuse Helpline on 0808 2000 247, or of course for anybody who is in any danger at any time, do follow the police advice and ring 999. And you can always press 55 if you can't speak on the phone, because the government, and we are very keen to support the government's message and the police message that there is help available for people who need it at the moment. Thank you very much for everyone for this evidence session. We're very grateful for your time. Order, order.
Can't you see it too? There's an elephant in the room.